Okay, Assalamualaikum. Good morning, everyone. Okay, today we will actually continue lah. Lecture the lecture that we postponed postponed on Friday. Okay, before that, okay, right. Okay, we continue. Last week we actually learn about the effects of drugs on CNS. Okay, the first two effects they have is actually the anti-convulsant, also the tranquilizer sedative, and also anti-anxiety effects. So we continue. Next is actually the effects on the analgesic effects of CNS. What drugs that works on the CNS lah. Okay, CNS drug. Okay, it's drugs that relieve pain lah. Okay. Okay, drug that relieves pain, okay, they are actually categorized as a non-narcotic or narcotic. Okay, one thing about analgesics is different from anesthesia. Okay, because anesthesia, the term itself means that it's loss of pain, at the same time loss of loss of reflex and also consciousness lah. If talking about general anesthesia lah. Okay, if in anesthesia, okay, if you actually administer anesthesia as told you last week, okay, the animals doesn't actually feel any sensation. Okay, they doesn't feel pain. Okay, in case of general anesthesia, they will actually be unconscious as well. Okay, but in analgesics, okay, they relieve pain, okay, but without other loss of other sensations lah. Okay, for example, if you administer analgesics, okay, you can still awake, okay, feel awake, you can still actually if the pain is not if can still feel touch, sensation lah, touch, heat, and all those stuff. Okay, the only thing that is actually that missing is actually the pain lah. Okay, all right. Now they are actually categorized into two. They have this non-narcotic and also narcotic. Okay, narcotic analgesics, okay, are used for moderate to severe pain, and they can actually refers to opioid lah. If it's a natural narcotic, they are called as opioid. And if it's a synthetic, meaning that it's being made, all right, they are called as opioid-like narcotics. Okay. So, oops. All right. So, as I said just now, okay, the opioids, they do not produce anesthesia. Okay. Patient still responds to sound and sensation. Okay. Produce analgesia and sedation, and also relieve anxiety. Okay, let's say if you have any of the other drugs, okay, they are used like alpha 2 agonist, okay, benzodiazepine. Okay, you can also use opioids lah. So you actually can produce analgesia and sedation. Also, they relieve anxiety. That's why you see people actually who are addicted to opioids, okay, they are actually in a sedated kind of mind, very calm. Okay, you see, that's why opioids actually can become one of the drug of choice lah. Okay, for people who are actually having depressions, mental problems, you can use it actually to relieve anxiety, okay, and sedation. Right, the effects of actually most common on opioids, actually they produce respiratory depression, okay, and it can cause excitement lah. Okay, if it's given too rapidly, like I say, if you calculate a dose and you're given it as actually a bolus for one shot, the whole dose goes together, okay, you can actually cause excitement, okay, if you're given directly. Alright, opioid receptors, okay, they are actually in the body. Okay, they have actually three types of opioid receptors lah. So meaning that opioids, okay, when they actually enters the body, they will actually bind to these receptors lah. Specific opioid receptors. Okay, we have mu, okay, mu receptors, okay, found in the brain lah. Okay. Right, mu receptors actually is the one that primarily responsible for the analgesia and primarily responsible for the analgesia and also associated with narcosis lah. Okay, right. This if most of the drugs, okay, most of the pharmacologists, okay, or person actually design these drugs, okay, most of the drugs actually when they design, they are actually looking at, okay, attaching, okay, the compound of the opioids to these receptors of the mu, because it is found in the brain. It control all this analgesic effect lah. Okay, so when mu receptors actually attach itself with the opioids, okay, it actually will produce respiratory depression. Okay, meiosis. You know what's meiosis? M-I-O-S-I-S. Is it pupil dilation or pupil constriction?
Constriction.
Okay, pupil constriction. Okay, the other one is actually mydriasis lah. Okay, the opposite is actually mydriasis, pupil dilation. Okay, it associated with respiratory depression, meiosis, and also hypothermia. Okay, hypothermia meaning that low in body temperature lah. Okay, that's hypothermia. Okay, a strong opioid, okay, with analgesic effect. Okay, if you actually use a strong opioid, actually trigger these receptors, mu receptors, it will actually cause a significant respiratory depression, meaning that if actually given a strong opioid is given overdose, it can actually cause respiratory depression and eventually death. Okay, so just most of the people who actually overdose on opioids. One of they actually two types of cause of death. One is actually respiratory depression, and the second one is actually cardiac arrest lah. Okay. Do you know how many Hollywood actors and actresses died of overdose? You know the late Heath Ledger? Kenal tak Heath Ledger?
Kenal, doktor.
Korang kenal Jungkook je. Jungkook, Jimin, V, korang kenal lah. BTS kenal lah kan? Tapi this one is actually one of the actors lah actually overdose on opioids lah, actually dies lah, the Joker. Right. Second one is actually the kappa receptors. Kappa receptors actually found in the cerebral cortex and also the spinal cord. Alright. Alright, when it's stimulated by an opioid drugs, kappa receptors, it also produces analgesia as well as sedation and meiosis, okay, without respiratory depression. Okay, that's the catch lah. So that if you actually wanted to design something, okay, on opioids, for example, maybe synthetic opioid, okay, and you don't want any side effects of respiratory depression, okay, actually you have to design the drug according to the kappa receptor, because it actually produces all these analgesic effects as well as sedation and also meiosis without any respiratory depression lah. Okay, and third is actually the sigma receptor. Okay, sigma is actually found in the brain as well. Alright. Okay, when stimulated, this receptor, they will actually cause dysphoria. You know what dysphoria means? It's actually excitement and struggling. Okay. It also causes mydriasis. Okay, opposite to the mu receptors, they call mydriasis. It's called mydriasis. And also they produces cardiac and respiratory stimulation seen in cattle, horses, and also swine. Okay, it can cause cardiac and respiratory stimulation seen in cats, horses, cattle, and swine. Okay. So, but again, um, we don't really use sigma receptors because the sigma receptors is compared to mu and kappa doesn't actually have that much an effects, greater effects of analgesia. Okay, so the ideally, it should be although the mu receptor is still the one responsible, but ideally, on a good opioid should be actually targeted the kappa receptors because it actually produces the anesthesia and also sedation. Okay, without any respiratory depression. That's a good thing about the kappa receptors Okay, all right. Example of opioids. Okay, we have opium. You know opium. The Malay word we call it as candu. Opium candu. Okay. One of the actually this is one of the drugs actually the one that is first discovered. Okay. Can be used as an opioid Okay, as an opioid, as a narcotic. Even the name itself is opium. The word opioid derived from the word opium. That is the first discovered Okay. So we also have morphine sulfate, meperidine, hydromorphone, butorphanol, hydrocodone, fentanyl, atropine, phenylephrine, also pentazocine. They are all opioids Okay. Some of these is still the natural one. Okay, and others actually the one that is actually the synthetic Okay, we have the natural. We also have the uh, synthetic, also the semi-synthetic. Okay, I will explain now which one is actually which. Okay. Okay. Before that, this is actually an advantage of using opioids for anesthesia or in anesthetic regime because if you use opioids as a pre-anesthetic protocol before you actually give the anesthesia to the animal instead they have a antagonist. Okay, meaning that if anything goes wrong with the pre-anesthesia, we always have the antagonist drugs actually to can reverse the effects of these opioids. Okay, that's why it's really one of they are used as a pre-anesthetic protocol, choice of pre-anesthetic protocol. Okay, I will actually explain more about this antagonist later. Okay, so the selected example of opioids, okay, it's actually or morphine sulfate. They are actually the natural opioids. Okay, they actually have effects. Okay, analgesic effects on the pain associated with central nervous system, the CNS. All right, they can on the CNS they are used for acute and chronic pain. Okay, and also morphine they produces an emetic action and also can be used as a cough suppression. Previous formulation preparation of cough medicine in the 70s 80s they contain a little bit of morphine. That's why people actually becomes more and more addicted to cough medication last time. If you can remember, I think what year you guys were born? 1985. You are 1985. Because born is 1990, is it? Kan?
1999.
1999. Oh, sorry. Oh, still young Okay, sorry. Okay, I think most of the time when you in the 90s itself it's actually they start actually to to reduce actually to phase out the use of cough medication actually contains morphine Okay. All right. For the respiratory, okay, they also cause they can suppress pain in the respiratory, something to do with the lungs. For example, if an animal I think undergo diaphragmatic hernia surgery, right? Okay. On the what diaphragmatic hernia surgery, when the actually the diaphragm they have like tear, so in that So after the surgery, normally it actually cause pain on the area. They can actually give opioids lah, or morphine lah, to reduce the pain lah. However, it actually cause also respiratory depression lah. Okay. Alright. They also produce analgesic effects on anything that is associated with GIT pain. Okay. And at the same time, the side effects of opium or morphine, they increases the tone of the muscular lah. They increase the tone of the stomach lah. Okay, meaning that movement of the tone of the stomach actually increases. Alright. It also used to reduce pain associated with the cardiovascular system with the side effect of bradycardia. Okay, it actually causes bradycardia. You know what's bradycardia? Slow heart rate. Okay, tachycardia is the opposite. Okay, have you guys learned all these terms? Bradycardia, tachycardia. Okay, if you're not actually haven't heard of the term, let me know. So I think you already know about bradycardia. Okay, so morphine when it's given orally, actually it absorbs slowly. Okay, that's why it is often used to treat chronic pain because it is absorbed slowly when you're given orally. Okay, and because of this, they are given to increase its duration of action. Okay. Okay, if the pain is actually a very severe and acute type of pain, for example, you have fracture, fracture, fracture of the bone, for example. Okay, normally our morphine are given IV or IM. Okay, all right. So half-life of morphine is around 3 to 6 hours. Okay. Right. Most of the inactivation of morphine after it is being actually utilized by the body is actually through the hepatic metabolism Okay. By the glucuronide conjugation. Dah belajar belum glucuronide conjugation in biochem? I think you guys remember the glucuronide conjugation of the liver, what the liver does. Okay. And also when the metabolites of the conjugated morphine actually will be excreted by urine. That's the reason why when you want to do urine tests, okay, they can actually catch you if you're using any morphine because they are excreted by urine. Okay, one of the things that is used, or morphine and opioids, opium, they are used as a performance enhancing for normally for horse racing Okay, we don't have another one is actually greyhound racing. Okay, we don't have any greyhound racing in Malaysia, but in Australia they are actually quite big the greyhound racing. You know what greyhound racing is? The greyhound dog. Okay, one of the criteria before you enter the competition is actually to do urine tests to check for any substances. And one of the substances they actually look for is actually the use of morphine and also opioids. Okay, all right. That's why they study the physiology of this drug. So it is very simple to detect. Okay. All right. The adverse effects of morphine. Okay. Okay. If you have an acute overdose of morphine, it will actually cause coma and respiratory depression. Okay. Coma and respiratory depression. Okay. And normally they are reversed by using opioid antagonists. Okay. So have you heard in the 1969 we have the Vietnam War? Okay. If you actually have the chance to actually watch any of the movies on the Vietnam War, or if you see the helmets of the soldier they have, normally they put cigarettes or whatever. Okay, one of the things actually they tie together on the helmet is actually a white packet. The white packet actually contains morphine. Okay, normally you have when you injured in the field. Okay, one of the painkiller that is used actually morphine. That's why the soldier, the Vietnam War the veterans, when they go back to the country, most of them actually suffered from morphine addiction because of the use of this morphine as an on-field, on-field painkillers during that time. Okay. All right. Another example of opioids. Okay, they are actually synthetic. Is actually butorphanol. Okay, they are. You see, butorphanol is actually one type of synthetic opioid. Okay, they are actually used as a cough control in small animals. Okay, for example, COPD in dogs, cats, COPD, chronic obstructive pulmonary disease. One of the symptoms actually the manifested is actually cough lah. Okay, that's why they use butorphanol, okay, as a cough medication of controlling cough in small animals. And also they use butorphanol to reduce colic pain in horses. All right. So larger doses of butorphanol occasionally cause excitement in aggressive horses. Okay. So if you give a large dose of butorphanol with dogs with with horse with colic, okay, they can sometimes become very excited and also some aggressive. So if you want to give this large dose of butorphanol to control the pain associated with colic, normally we actually give together with a sedative lah, such as xylazine. Okay, they are given together. Okay, so the next is actually a semi-synthetic. Okay, semi-synthetic. This one butorphanol is synthetic, and example of semi-synthetic is atropine lah. Okay, atropine. Have you heard of the drug? The treatment normally associated with atropine is immobilon. Immobilon. Immobilon is one of the associated trade name lah used for atropine lah. Okay, who knows what atropine normally used to sedate who? To sedate what? Anybody know? Okay, atropine normally used to sedate wildlife and zoo animals lah. Okay, so if you see, because why is that they are used to sedate wildlife and also zoo animals lah. Okay, most only zoo animals, they are quite large in size lah. For example, elephants, giraffe, rhinos, what else? Big animals, wildlife, tigers, lions. Okay. Alright, because of this, because of the large body of this proportion of the body, they don't require much opioids actually to sedate these animals lah. Okay, normally they use atropine because atropine is a very potent analgesic because the analgesic potency is 1,000 times potent than morphine. Okay, 1,000 times. You know, meaning that 1 milligram of atropine equivalents to 1,000 milligram of morphine. You see how potent it is. Okay, so this is the reason why also you must take precautions when using atropine, because if actually accidentally you actually injected atropine to handlers, can cause CNS depression and also respiratory arrest, quite acute. Okay, that's why it is care or precaution should be taken before using atropine to use it on wild animal and also zoo animals. Okay, actually there's a case in Zoo Negara, I think in 80s, I remember. One of the handler actually wanted to sedate I think an elephant, but accidentally poke the needle containing atropine on the thigh per. So death is actually quite instant lah. Okay, so we actually have to be very careful by using atropine. Alright, any questions on opioids? Okay, if no, we move to the opposite of opioid, which is the aqueous antagonist. Okay, this is the drug actually used if you want to reverse the effects of the opioids. Okay, so how does opioid antagonist does that? Actually, it blocks the binding of the opioids to their receptors. Okay, so meaning the opioid receptor like mu, kappa, and also the sigma. Okay, before the opioids attach itself to the receptor, okay, the antagonist will attach. Actually, it doesn't cause anything. It just prevent the binding of the opioids to the receptors. Okay, normally opioid antagonists used to treat respiratory and CNS depressions because of opioid use. Okay, Examples of opioid antagonists, okay, you have naloxone and also naltrexone. Okay, you guys like to watch movies, old movies lah. Have you watched Pulp Fiction? Have you watched Pulp Fiction? Pulp Fiction. Running where?
Yes.
Have you heard? Do you watch the scene when Uma Thurman actually exactly overdose on opioids? You know what does she does? What does the other person do? I can remember that guy. What does the person do? Actually, it actually injected the naloxone or the opioid antagonist directly to the heart intracardiac. So actually to reverse the effects of naloxone. The effect of opioids. Okay, right. Some of the things on the Hollywood movies you can actually look actually learn lah. Tapi most of the time, all of them are crap lah. Okay, fantasies lah. But things that actually you can learn and try to actually distinguish between something that is real or fact, something that is fictions lah. Okay, alright. Alright, another type of action they have is actually called as neuroleptic analgesics. Okay, what is a neuroleptic analgesics? Okay, in a general term, neuroleptic analgesics refers to a state. Neuroleptic anesthesia refers to a state of CNS depression and analgesia induced by a combination of a sedative such as ispromazine or diazepam and analgesics such as morphine. Okay, I repeat. Neuroleptic analgesia refers to a state of CNS depression and analgesia induced by a combination of a sedative such as ispromazine and diazepam and analgesics such as morphine. Okay. Alright, can cause a state of depression and analgesia and may or may not produce unconsciousness. Depends on the dose lah. Okay, if the dose is high enough, sometimes it can produce unconsciousness. Okay, if the dose is actually the correct dose, okay, it may not produce any unconsciousness to the animals lah. Okay, combinations, okay, products, okay, may be prepared by the veterinarian, meaning that if you have later on when you graduate, okay, if you want to have your own neuroleptic formula, you can use based on the drugs available to you lah. If you have morphine, for example, or any other opioids, you can actually combine it together with other sedative lah. Okay, however, they are actually a commercial commercial neuroleptic analgesics products that is available. It's called as Innovavet. Okay, the trade name is Innovavet, INNOVAR hyphen vet, VET, INNOVAR hyphen vet, VET. Okay. In this neuroleptic, okay, they contain droperidol, okay, another type of sedative, okay, and fentanyl. Okay, it contains droperidol, DROPERIDOL, and fentanyl. Okay, fentanyl is actually a narcotic analgesia lah. Okay, fentanyl spelling is FENTANYL. Okay, FENTANYL. Okay, it's a type of narcotic analgesia. Okay, this is actually Innova compound found in Innovavet lah. Okay, alright. Okay, other examples, if you wanted to do your own preparation, you can combine with ispromazine and morphine. You can also combine xylazine and also budopanol and becomes a neuroleptic analgesics. Okay. Alright. Okay, another type of drug that works on the CNS is actually causing a stimulation of the CNS lah. Alright. CNS stimulants, okay, they are used to reverse CNS depression caused by CNN depressants. Okay, there's a difference, depression caused by CNN depressants. Depressants is actually the drugs lah. Okay. One of the example of drugs that are used as a stimulant is actually doxapram. Okay. Doxapram stimulates brainstem to increase respiration in animals with apnea. Okay, apnea actually no breathing at all. Okay, no breathing. And bradypnea is actually shallow breathing lah, slow breathing lah, bradypnea. Okay. Commonly used when animals have C-sections. Okay. There's a story tak dengar cerita tak? One can tell you a story tak? Actually a true story that happens to me and my classmates during our 4th year UVM. Nak dengar tak cerita?
Tak.
Okay. Alright. It was actually during our rotation. Okay, small animal rotation. Okay, we have one in the old faculty lah. Kalau tahu kan dekat main campus. Okay, actually around 8:30 at night lah. Okay, our VO, our briefing officer at that time actually hasn't arrived yet. So we actually the 4 hours lah in the wards lah doing work lah. And suddenly there's a makcik lah. Okay, came to the wards brought a cat. Okay, a mother cat lah. Okay, a queen, sorry, mother cat lah, queen. Okay, actually which is pregnant lah. Okay, you can see the stomach is actually the uterine, the abdominal area besar lah. So, okay, but the animal, the queen actually not breathing, already died. Okay, dah keras. Tapi you can see the abdominal area still there is a movement lah. Meaning that the kitten is still alive in there. Okay, what we do is that we do an emergency laparotomy lah. The laparotomy is actually cutting the abdominal cavity, the longitudinal section. So we did what we did lah. We have to do lah because there's no time for actually to save the kittens lah. So what we do is that we cut and then there's actually 4 kittens in the the stack lah. You set the uterus lah. So what we do is actually we cut open the uterus, okay, and then remove the 4 kittens lah. Okay, what we do is that one of the things that we have to do, because some of the kittens not breathing, we have to actually give a doxapram lah. Doxapram actually we give because it is to have a rapid action. We have to do IV, but IV very small in kittens, like how many grams in kittens. So what we do is actually we put some drops lah of doxapram under the tongue. Okay, itu actually and then stimulate lah. Actually we have to rub alhamdulillah eventually only but we managed to save like 3 kittens out of 4. So one actually die lah. That's the true story lah about doxapram lah. So meaning that whatever you study the lecture, if you have faced in the situations, try to actually practice lah. Okay. We just because we didn't DVM 4, we just have pharmacology in DVM 3, so the knowledge is still fresh lah. Kalau dah final year memang lupa lah something lah. Okay, like that lah. You actually whatever you learn in the class actually you have to use lah when you actually face on the real situation lah. Okay, that's the story lah. Not interesting pun tapi just to relate to the lecture lah. Okay. Another type of CNS stimulant that can be used is actually methylxanthines. Okay, they are actually bronchodilators. Okay, they have adverse effects on the CNS stimulation. Okay, one of the methylxanthine, caffeine is a type of methylxanthine. Okay, not the caffeine is one, another theophylline and aminophylline. Okay. Side effects, okay, they can cause some sort of gastrointestinal, mild gastrointestinal irritation, not that actually very severe, and also bronchodilation. They are actually the effects of methylxanthine. Right. Okay. There another, I think I didn't put in the lecture. Okay, there also another type of drugs that can be used as a CNS stimulants. Okay. It's called as yohimbine lah. Okay, yohimbine is spelled as YOHIMBINE. Yohimbine. Yohimbine actually alpha 2 antagonist lah. Okay. So they can actually reverse the effects of an alpha 2 agonist such as xylazine. If we have a xylazine overdose, okay, normally we use zohimpine as the antidote for the antagonist. Okay, all right, that's the stimulants. All right, another type of drug actually used as a euthanasia solutions lah. Okay, euthanasia is actually used to humanly end an animal's life. Okay, the example, if the animal is actually having diseases, for example, cats with FIP, okay, infectious peritonitis, a wet form of FIP, normally the treatment won't work. So, actually to reduce the burden of the animals, okay, from suffering, further suffering, normally the vets and also the owners will take options actually to humanely end an animal's life. Okay, one of the drugs they are used as an euthanasia solution is actually pentobarbital, sodium pentobarbital. Have you heard of Dolittle? Pernah dengar Dolittle? Dolittle is a trade name for drugs used as a euthanasia in dogs and cats lah, in animals lah, obviously, even in horses as well lah. Okay, because we don't in cattle is, if you want to euthanize using pentobarb, how much you have to give lah. So normally cattle also because we can still use the meat for consumption lah, normally we slaughter lah. It depends lah. Pentobarb is actually a cost effective. You have to really look at the cost effective measures lah. The animal can be euthanized using measures that actually very not to say cheap lah, it's more cost effective than use that lah, okay, instead of using pentobarbital lah. In Malaysia, our pentobarbital is red, no? But if you go in Australia, the pentobarb, so the pentobarbital Dolittle is color green. So every time they wanted to actually euthanize an animal, like a pet for example, they will put inside the notes to the nearly or technician, actually put the animal in green dream. So when you understand lah, when you say put the animal in green dream, meaning that to actually euthanize, because the color of the solution is actually yellow, okay, in color. Right. So when okay, this one is actually quite difficult to understand. When pentobarbital is the only narcotic agent present, okay, it is a C2 controlled substance. Okay, example, Dolittle is considered as C2 controlled substance because inside Dolittle contains only sodium pentobarbital. Okay. Let's say if the sodium pentobarbital is in combination with other agents, meaning that they are actually combined with other type of respiratory depression or cardiac depression drugs. For example, given together with opioids, for example, to reduce the pain associated with the euthanasia. Okay, it is called as a C3 controlled substance. Okay. Sodium pentobarbital is still a controlled drugs, okay, meaning that if you wanted to do any euthanasia, it might require the procedure must be performed by a licensed approved veterinarians. Okay, they cannot be used for layman people, okay, students itself cannot actually use itself until later on when you become a vet and you have license and you are you are actually qualified to, you can actually give lah, okay, or actually to administer these drugs lah. If you go to the wards lah, to our pharmacy, this drug actually located inside the metal safe box, the metal safe box. Okay, all right. So common route of giving euthanasia to animals is using either IV. The IV is the most fastest. Okay, they also can be given through intracardiac. Okay, IV although the fastest, but not as fast as intracardiac. The thing about using intracardiac to give anesthesia, to give euthanasia directly to the heart, actually based on skills lah. Okay, certain people actually been doing this for what countless of times, then no problem with giving intracardiac. Because giving intracardiac, one thing is that it is quick. Okay, the suffering of the animals actually they doesn't suffer that much. Okay, but to see whether you actually give the drugs directly to the heart, that's the problem. Yeah. Do you want, if you want to see the best, most skilled person to give intracardiac to dogs, then you have to go to DBKL, okay, somewhere in Stapak. There's the DBKL animal shelter somewhere like that. Somewhere there, if you, I don't know whether you actually been there for your practical or not, but over there they have personnel who actually do this. If the dogs is not claimed by any owners after couple, actually quite sad. After the dogs not claim, maybe nobody comes actually to adopt these dogs. So actually it becomes a burden in terms of resources to this center. So they have to actually euthanize the animals So because of they have experience doing this, they can actually give the intracardiac without any difficulty locating the heart, because they know which actual area, which the anatomical structure or the area location they actually give to actually poke a needle to the heart. Okay. Alright. They also can be given through intraperitoneal. Okay, intraperitoneal normally given to euthanize laboratory animals like rabbits, mice, rats, okay, guinea pigs. Okay, they are given for euthanasia. For example, later on when you have FYP, you're using lab animals as your experimental animals. You have to, at the end of the study, you have to euthanize, and normally we give to peritoneal. Okay, it's also another route that you actually quite fast Okay, alright, that's for today. CNS drugs. Any questions? Nimalan, I still have another lecture this week. My lecture as well. Tomorrow and Friday.
Yes, doctor.
Oh, okay. All right. So, any question? Okay. If not, thank you very much. Okay, I'll see you guys tomorrow at same time. Okay, same link as well for the lecture on the. Yes, now today and last week we did on CNS. Tomorrow we're going to do on PNS the peripheral nervous system. Okay. If not, thank you very much. I'll see you guys tomorrow Okay. Assalamualaikum.
Thank you.